Testing 1, 2.
Okay, so
Testing. Good morning, everybody. Can you hear me okay? Yeah. Good morning. Thank you so much for coming out today, everybody. We are getting ready to kick off the presentation. If you'd like to grab a seat, and lunch will be served shortly. First off, I wanted to start off by thanking everybody for taking the time out of your busy Friday to come out and learn about the benefits of medical cannabis for seniors and for veterans. We're really excited to be here today and so thankful to the Relief Clinic and GI Green for partnering with us to be able to provide this education. I would like to start off this morning by introducing a fantastic physician. She is a veteran and a graduate of the University of Florida College of Medicine. I think at that time it's appropriate if you're a Gator to cheer. We're very, very honored to have her. She's actually currently pursuing her master's in cannabis therapeutics. So she is very educated on the endocannabinoid system and all of the benefits. So I'm very excited to introduce my friend, Dr. Dury, today.
Thank you. Gotcha. Thank you. Hi, we're going to try and make this painless and quick. Just some basics on marijuana, particularly if you used it in the past and you're now new to it again, because it has changed a lot. Want to thank Truly for helping us sponsor all this and be here for you. Cannabis in older adults is a little bit different than cannabis in younger people. Sure, is that better? Matter of fact, it says we're the fastest growing use of cannabis users in the country, being older adults. Unlike younger people who use it recreationally, most of us older adults are using it for different things like pain relief, sleep, anxiety, not necessarily just for recreational purposes. It's been a controversial topic for decades, but the landscape's changing. There's less social bad connotation to it as there was in the past. It's getting better. Many states now allow medical or recreational use, and the research on this is steadily growing. The good news is Florida is a medical state, so we can accomplish what we need to with that. Cannabis is a plant that has some active chemical substances in it. The two most common ones that we know are THC and CBD. THC is the one that can make you high, helps with pain, nausea, appetite, other things. CBD does not cause any kind of intoxication, but it can help with anxiety, inflammation, and seizures. The good news is, unlike when we were pups and we got a brown paper bag with some stuff in it and you didn't know what it was, and sometimes you wish you didn't know what it was, now we can get all kinds of different forms. And the good thing is, if you find something you like, you can duplicate it. And if you find something you don't like, you know what it is so you can avoid it in the future. We didn't have that luxury before. We now have smoking, vaping, oils, tinctures, edibles like gummies, baked goods, cookies, fudge, capsules, topical creams, and balms. One thing to note, cannabis products are much more concentrated these days, much stronger than they were a decade ago, and the results can be much more intense. Older adults can consider cannabis for several reasons. Pain control, such as arthritis, back pain, and nerve pain. Sleep problems like insomnia, restless leg, anxiety, stress, any conditions connected to health changes or caregiving. Particularly good for appetite stimulation, which is good with people with cancer or chemotherapy, or chronic illnesses. Also excellent treatment for spasticity and tremors and conditions like multiple sclerosis or Parkinson's. Some of the potential benefits in adults is it reduces our need on opioids and sleeping pills and other more toxic treatments. It can improve the quality of life and actually, help our daily functioning improve. CBD can ease anxiety without causing any of the high associated with cannabis, with the THC part. And some people report overall improvement in mood and social well-being just with the CBD. It's important to stress that the evidence is still mixed. Some studies show clear benefits, others show limited. It's a lived experience of many older adults that cannabis can make a meaningful difference. There are some risks to consider as an older adult. Our metabolism changes with age, so cannabis can have stronger effects on us than we normally get, make you dizzy, give you some confusion, and can even sort of precipitate falls if you're not careful. Can interact with some medications, particularly blood thinners, sedatives, and some cardiac meds. That's why when you hear me asking you what meds do you take, it is important. Edibles can be tricky as we get older. They take longer to kick in, and it sort of leads to that effect of, if it didn't work, I'll take another and another, and pretty soon you've got too much, and it can get some unpleasant side effects. The good news is nobody dies, it's not toxic, but it can make you feel badly. Headache, nausea, dizziness. It's transient, but that's the one reason with edibles to go slow. Excuse me, go slow, give it a try, see how it works out. Smoking and vaping can cause chronic cough and actually aggravate an existing cough or any lung disease. And there's some evidence that cannabis can increase cardiovascular strain. So if you have a serious cardiac condition, that's something I would definitely advise you to talk to your doctor before you use. Most of you who have a serious problem would know it and know what I'm talking about. There are many potential benefits, but you need to be safe and be careful. The cannabis live. Some allow use, which is Florida. Others have medical and recreational. And a few states have no cannabis. Fortunately, we're not one of those. In Florida, medical use is allowed, and that's what the Relief Clinic is going to help you navigate. At this time, Florida does not have reciprocity with any other states. There are some states that will recognize an out-of-state card, but Florida does not do that. Dispensaries in Florida are basically cash only. They all have ATMs, but there's some alternatives to that. If you have any questions about that, CanPay is a good place to look. And if you ask us, we can tell you about that. It is not covered by insurance, and most health spending accounts do not cover it. So just to wrap it up, basically what we tell you is if you're going to start with cannabis, start low, work up gradually. You can always take more. It helps you avoid the unpleasant side effects and can assist you finding what your dose is. That's the difficulty with the cannabis, is we can't really prescribe and say take this much. It's not like a blood pressure med where we can check your blood pressure and say that's the right dose. You're the one who knows what your dose is. So start slow, keep track of it, and go up gradually. Eventually you'll get to that sweet spot where you're getting the results that you want. Start with non-smoke products like tinctures or topicals, capsules, and edibles. Easier. Smoking and vaping can be much more potent than you would appreciate, particularly, like I say, if it's been years since you used it. Store it safely away from heat, moisture, and children. If you make your own products, I urge you to label them. I've seen a few mis-accidents with that, where people pick cookies out of a freezer and didn't realize they were cannabis cookies. Yeah, unpleasant surprise. Talk to your primary care. Most are on board, some are not. I hate to tell you to change your doctor, but most are coming on board now and will support you in that. Like I say, especially if you're taking prescription meds, because there are some medication contraindications. So to wrap it up, cannabis use among older adults is increasing. We're the rising population, but it does carry some risks. Like I say, watch your medications, talk to your primary care about it, and it can help most of us live more comfortably than we were. Questions?
We'll open it up for Q&A in just a moment.
Okay, good deal. Thank you.
Dr. Dury.
Yes, ma'am.
Thank you so much. We really appreciate all of your knowledge and wisdom, and would like to hand it over